in the available contraceptive methods is we need to understand the female completely, not by her psychological condition, emotional status, but the physical endocrinological condition where she reacts or reflects her own symptoms in a different manner. So while we are dealing with the contraception regarding herbal or regarding Ayurveda point of view, we need to understand the whole cyclical health of the woman. That is the takeaway message or baseline message from my presentation. So the cyclical health, complete health of the woman is mandatory. Next slide, please. Hello, next slide, please. Dr. Jayesh, next slide, please. So there are research references I've gone through. We conducted research at Podar Research Hospital on neem tail. When we administer 1 ml neem tail before the coitus or the contact, it has got the spermicidal activity, and because of this spermicidal activity, we can prevent the pregnancy. So precoital neem tail instillation is useful for the condition of dyspareunia also. Female can like side benefits this neem tail is having, its antibacterial properties, and even the oil lubrication causes helps her for to prevent the pain from the coitus or the dyspareunia. So neem tail administration. Next slide, please. Japa pushpa churna we administered, and that japa pushpa uh, churna help the patient for the greater vaginal secretion of maturation, or greater it helps the woman for जो दुर्गंधी आती है स्रावों से, जो भी तकलीफ होती है, रिप्रोडक्टिव ट्रैक्ट इन्फेक्शन रिकरेंट होते हैं, उसका प्रिवेंशन इस जपा कुसुम से भी होता है. ये जपा कुसुम प्रदर निरोधक इस तरह से बोला है, एंटी लुकोरिया इसकी प्रॉपर्टीज है, और इसको कॉन्ट्रासेप्टिव केस में जब प्रयोग किया गया, अल्बिनो रैट्स पे भी ये रिसर्च हुआ है. पूरा साइंटिफिक रिसर्च है. जैसे ये रिसर्च पेपर हम देख रहे हैं जिसमें डॉक्टर जयश्री जोशी और वीरकर जी है, पीके देवी जी है, उन्होंने इफेक्ट ऑफ एन आयुर्वेदिक प्रिपरेशन ऑन पेरिफेरल पैरामीटर्स ऑफ द मेंस्ट्रुअल साइकिल, इसके ऊपर बहुत अच्छा काम हुआ है इसमें. नेक्स्ट स्लाइड प्लीज. So had studied 1 premenstrual cycle to demonstrate ovulatory cycles, and then 3 study cycles and 1 post-study cycle effect on menstrual cycle length, side effects, drug compliance, cervical mucus changes, postcoital test, endometrial biopsy, and post-ovulatory serum progesterone levels. So it helped the woman in all the manner. Next slide, please. Hello, next slide, please. So there are many research papers regarding this. Next slide, please. You can go through this research paper. And this research is like since 1966 or 70, we're continuously doing research on herbal contraception, or where we use herbs for the contraceptive methods. Next slide, please. So we have, this is research, our published research calculations, where we can understand how this contraception was useful for the female. Next slide, please. Dr. Jayesh, next slide, please.
Yes, madam.
See, we are dependent on the other help. So collaboratively, we are presenting this presentation. Dr. Jayesh is helping me for moving the slides, and I'm communicating with you all, the eminent listeners, patient listeners. Next slide, please. Hello.
Yes, madam.
So this way, the holistic contraceptive methods also are useful, where we can monitor on with different latest available technologies like cytological study, pap smear, sonographical monitoring of the ovulation, post-coital test of the cervical mucus for spermicidal activity of herbs. So combinedly, holistically, we can monitor the result of the herbal contraceptives. Next slide, please. I'm not able to see the slide actually. I'm new to web meeting, maybe
Ma'am,
due to that.
I've shared
I'm
the
not able
slides,
to
but
see
I
the
think
slides
network,
here.
just a
Some
second.
network issue. Okay, let it be.
Network
Am
issue,
I
it
audible?
seems. Yes, ma'am, you are audible.
So let it be. The slides, we'll keep the slides aside. In nutshell, I want to share you the baseline interest when Dr. Pawan Kumarji said that we are celebrating World Contraceptive Day. I was very happy. I visualized, I recollected all those days when we took the
Is there any
privilege
problem,
to.
Dr. Jayesh?
Hello?
Is there any problem?
For
Sir, I'm
slides, some
resharing the
problem.
slides. I'm resharing the slides. I think there is a network issue. I'm just
I am sharing.
resharing.
Just give me 1 minute. I am sharing.
But am I audible? So I can talk to you all. Am I audible, sir?
You are audible.
Ma'am,
You
you
are
are
audible,
audible.
madam. You can continue.
So I will conclude. No worries. No worries. The slides are only to like a passing reference for me. We have
No problem.
like I'm practicing for last 30 years and
You,
each
you
and
can continue
every
at
day.
tempo, madam. No doubt.
Hello? Can I talk?
You
So I
can
can complete my
continue.
talk. Yeah.
Yes.
Yes. Thank you, sir. Thank you, sir. Thank you, Pavanji. Thank you, Jay, sir. So, see, each and every day I learn different things from my female patients, and the baseline thing I learn is patience. That patience gives rise to her creativity and gives rise to her womanhood. And just I'm confident that the holistic approach of our basic principles definitely will create a new innovation in the contraceptive field, as many of the herbs we use, some of the drugs showed failure. Certainly they showed the failure because certain problems were definitely there. We had to administer in a very big dosages, then 2-3 times medicine for only contraception. That female were not very much, they were reluctant to take 2-3 times a day dose for the contraception, herbal one. But definitely I can say, because help of this holistic basic principles help in the contraceptive field, we can definitely help the woman to enhance her womanhood, as it literally gets absorbed from the vaginal mucosa. The oil administered through the vaginal mucosa gets absorbed and it circulates into the reproductive organs, and it helps to enhance her uterine cavity health. And that is also a very important thing. So psychologically, physically, emotionally, and yes, sometimes spiritually also, these herbs help her for a live her life in a better manner. So surely I can say one thing here. In this eminent in front of these eminent personalities, yes, we have some restrictions or we have some limitations to use the herbs as contraceptives, and there are many n number of options available. Like nowadays, too, without means we all were looking for the non-hormonal contraceptive pills, and nowadays there are some of the options where less amount of hormones are used. Yeah, now the slides are
Hello.
visible.
I have
So,
shared the presentation.
yes,
Please tell me which slide number to be done.
Dr. Jayesh, can you help me again?
I have shared already.
Okay,
Madam,
so next slide. Yes, next, 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 next. Next slide, please. Next
It's
slide,
15,
please.
15.
Next, next, next. We were here for looking for the research papers. Next slide. Next slide. All these research papers are available in my slideshow, so you can go through. So definitely, we have limitations for herbal contraceptives. That was the conclusion made by our research. But we can use certain Ayurvedic concepts for abstinence method. We can take Rutumati concept where we can list out the symptoms of the woman when she is highly fertile. So along with the baseline temperature method, ovulation monitoring method, we can include this symptomatic questionnaire in fertility index of the female. Next slide, please. So Rutumati concept from the basic constitution of that female is also important. Physical constitution and mind constitution. When the female is kapha dominant, she is more and more fertile, and even sattva dominant mindset allows her to develop her patience. She has the forgiveness, patience, or she is uh, fertile, because the baseline important quality for fertility is mudita, happiness. So both the constitution wise, the female should be examined. We can inculcate in our contraception model. Next slide, please. And classical contraceptives are Vidanga, Nirgundi, then Chitrak, Pippalimul, Tankan. In previous days, we use these herbs for feticidal also, means when MTP like action, some of the drugs has like Garjar Beej or even Tankan Khar, and this Talis Patra Neem work has very good antibacterial property. It prevents the reproductive tract infections, and we are doing one study on this. When we are preventive reproductive tract infections, because of that we can prevent the reproductive cancer also. Next slide, please. Dhatura, jaggery. So the intensive research on herbal contraception is ongoing process. It's still on, and we are doing this. Next slide, please. So again, where I started, I'm ending my presentation with this. Varam eko guni pitputro nacha murkha shatanyapi. This is the takeaway message from this presentation to all you eminent listeners, that contraception, yes, we need to take help of modern available chemical drugs, but we can support it with our own herbal formulations which can enhance her womanhood, and we need to focus on the beta progeny. If we can give the beta progeny concept to the world, this beta progeny concept, Supraja Sanskar project, will be accepted globally, because when we are celebrating contraceptive day, we need to remember that whatever a child we have, only when we are opting for one child, only child, that child should be the best quality. He should or she should carry the best quality from mother and father, and for that, along with family planning, we need to plan for the better progeny also. So this is my takeaway message, and I will conclude my talk with this. And I wish each and every one you the happy Bhadrapad Mahina.
Thank you. Thank you. Thank you.
Sarvepi Sukhina
Excellent, madam.
Sarve Santu Niramaya. Thank you.
Excellent, madam. Excellent. Excellent.
Thank
Wish you all the best. Great, great. Thank you. Thank you. Thank you very much. Dr. Jayesh. Dr. Jayesh.
Thank you, Dr. Kulkarni ma'am, for your wonderful presentation. A basic idea and the importance of contraception to family planning, ma'am have really explained in a wonderful way. So we are really grateful to madam. The question answer and the discussion session will be in the end of after all the speakers have presented their presentation. So in the chat box, anybody have any points to discuss or any questions that can be raised in the chat box. Our program is also live in YouTube channel of Independent Research Ethics Society. So moving on to our next speaker of the day, we have with us Dr. Madhu M. Madam. Dr. Madhu ma'am is Associate Professor in Department of Prasuti Tantra and Stree Rog in SDM College of Ayurveda, Hassan, Karnataka. She has an experience of 10 years. She has presented many research papers in national and international journals and seminars. She specializes in local treatments with Ayurveda, have delivered many health talks, has guided 10 PG scholars in continuing and is continually guiding more PG scholars. She has submitted PhD research paper in Kachi University, Chennai. So let's take the pleasure to welcome Dr. Madhu Ma'am M. Madam, you're welcome. I'll be sharing the slides on behalf of you. The stage is yours. You can start your presentation.
Welcome, madam. Welcome. Please proceed.
Madam, Dr. Madhu ma'am, you can switch off your video. That will give a better network coverage. I think आज network का थोड़ा problem है, तो सबको थोड़ा थोड़ा problem हो रहा है, कुछ network glitches हो रहे हैं. Madhu ma'am, let's take a few seconds. Dr. Madhu ma'am, can you switch off your video and rejoin and see in case if there is a network issue? You're unmuted.
No?
Madam, now it's audible. You can start your presentation. Welcome.
Yes, yes. Yeah, let us start. So we have heard Dr. Madhura ma'am's presentation. Let us move on to a few concepts what are told in Ayurvedic science about the contraception, because nowadays we can see that almost all the things what we follow is of modern techniques. Of course, we have to sometimes, but still we have very nice concepts and medicines which can be followed in our according to our science too. So today let us have a small brief look on the contraceptive methods which are told in our classics, so that we will at least have a knowledge that what our ancestors have explained and what are explained in Ayurveda, very nicely explained, and a few of them like we can practice, and many of the doctors are practicing the things. So today we'll have have a small brief look into it, right? So the introduction is
Hello, madam. Again, I think there is a network issue.
Hello. Hello.
I think, hello.
Is there any
there is
problem?
network issue, I think, from Dr. Madhu ma'am's side.
No problem. No problem. Please wait for
Just
him.
few seconds.
Okay, a few seconds. Wait for a few seconds. Madhu के वहाँ
Yes, madam. Madam, we cannot hear you. So let's wait a few seconds as Dr. Madhu ma'am rejoins.
No problem, no problem. These are the technical glitches. It can happen anywhere. Don't worry. All the best.
Meanwhile, as Dr. Madhu ma'am rejoins, we would like to share that our program is being live in the YouTube channel of Independent Research Ethics Society. So after the completion of program, later on, anybody wants to share the link with their students and with more other IU students and scholars, they are welcome to share the link. And as we know, we celebrate Ayurveda in every day. Tomorrow on 27th, we'll be having a webinar on ENT. And thereafter on 29th, on account of Lifestyle Disorders Day, we'll be having a webinar on cardiovascular system. So every day we'll be celebrating with Ayurveda and with our Ayush system. And we have also today our next speaker, Dr. Paraswani Madam. She is from the field of Unani. So just few seconds as Dr. Madhu Ma'am joins back, we will just recontinue. We have with us also Dr. Suhas Sethi sir with us. Sir is also from Hassan. Dr. Sethi sir, can you help out? I think Dr. Madhu ma'am is not able to join.
Yeah, I'm contacting her, sir. I'm contacting her.
Okay.
I told her.
Okay,
She's
thank you,
secondly
sir.
joining. Yeah.
Yes, yes, sir.
If there
On
is
the Galaxy. Yes, sir.
if there is problem, we can invite Dr. Paraswani first, and then Dr. Madhu can join. If not problem, just
Yeah,
check the
Dr. Sethi
status.
sir has just contacted her.
Ah,
Otherwise, we'll go with the third speaker of the day, Dr. Paras
right.
madam, and then we will
Suhas Sethi ji
recontinue
is
with
there.
our.
Please
Yes, yes.
communicate your regards to Suhas Sethi ji also, because he has really supported us valuable. Really.
Sir, she's joining again. I have contacted her. She's joining again.
Thanks. Welcome. Then continue.
She's waiting for, I think she's telling that she's waiting for you to allow her.
Jai ji allow kar diye na.
No, nobody is in the waiting room at present. All are allowed.
Yeah.
I think there is network.
Please, whenever she comes, please allow her.
Yeah.
Thank you.
Definitely.
Suhas ji Zindabad. Suhas Sethi Zindabad. हरि
Sir,
ओम।
sir.
अभी मैं दिल्ली में प्रोग्राम में हूँ।
हाँ सर, पता चला सर।
लेकिन अपनी परंपरा नहीं छोड़ेंगे, मतलब नहीं छोड़ेंगे।
आप तो इंटरनेशनल है सर। मैं I'll contact get back.
ओम जी नमस्कार।
Welcome, Dr. Vishnu Prasad Sharma ji.
Okay, thank you.
We have also Saikat Kumar Basu sir joining with us. We have Vaidya Tapan Kumar sir from Gujarat with us. And among the galaxy of audiences, we have Yunis Munshi sir also with us. So after completion of all the speakers' presentation, we can definitely have a discussion on this very important topic. So Dr. Sethi sir, can we go with Dr. Paras ma'am's presentation without wasting further time? Dr. Paras ma'am?
Yes, sir.
Hello. Madam, if you are ready, then can we go with your presentation first?
Definitely, sir. So
Yeah,
can I share
I'm
the
stopped.
slides?
Yeah,
Yes.
you can. I've just stopped sharing. You please share your slides now. And we'll have Dr. Madhu ma'am as the next presentation. Okay, welcome ma'am. Let me read out a brief about Dr. Paraswani madam. Dr. Paraswani madam has done her MD from Jamia Hamdard with a gold medal. She is presently working as medical officer in Unani in the Directorate of Ayush, GNCT Delhi, and in charge of GTB Unani unit and ISBS Unani unit. She has more than 10 years teaching experiences. She has more than 50 publications in national and international journals and has also written a book on cervical cancer. She is a reviewer of many STM journals like IJSTR, STM journals. She is in the editor board member of many journals. She has been in the International Journal of Medicine and Pharmaceutical Sciences, Journal of Medical Sciences and Clinical Research, and she is also the reviewer of abstracts in American Public Health Association and member of Geneva Foundation of Medical Education and Research. She has received Asian Education Award 2020 for a contribution in medical science and Best Unani Physician Award. So let us welcome Madam to our forum. So Madam, the stage is yours. You can start with your presentation. Meanwhile, just to inform, Dr. Madhu Madam has also joined, but we would like to have Madhu Ma'am after Dr. Paras Madam completes, sir.
Okay, sure,
Okay,
sure.
ma'am? Yeah,
Okay,
yeah.
okay.
Okay. As we have already said her presentation,
No
and
issues.
um,
Continue.
yeah, Dr. Paraswani Madam. So we are really glad to have such an experienced Unani speaker on today's program. So, Madam, you can begin. Welcome, welcome.
Thank you, sir. Am I audible to everyone?
Yes, Madam, you're perfectly audible. The slides are also visible. You can begin. Thank you.
Thanks a lot, sir, for inviting me on this webinar. And first of all, I would like to congratulate all of you on this World Contraception Day. And we all, Ayush fraternity, have assembled here to discuss about the Ayush contraceptives and what we can do in future. Basically, I was not keeping well for a couple of days, so you have to bear with my voice. Without wasting any time, I like to give an overview of Unani contraceptives and what are the challenges we are facing. We all know that contraceptives is the need of the hour and population is growing. So I will not go by those details, but in Unani system of medicine, contraceptive is called as Mane Hamal. Hamal means pregnancy, and to stop pregnancy, all those measures which we adapt to stop pregnancy is contraceptive. And this is a very interesting report which I would like to share. That is about 214 million women of reproductive age in the developing world want to avoid pregnancy, but they are not using modern contraceptive methods. So here is the need of unmet need for the alternate contraceptives. Sometimes what we have seen, the data says that 59 million women, they rely on the traditional methods such as abstinence or withdrawal methods, and 150 million, 55 million women, they do not simply adapt contraceptives because they think they are not safe, the conventional method, they have lot many side effects. So here, this slide I have put so as to emphasize the need of Unani and Ayush contraceptives in this time. going back to the history of contraceptives, it is very interesting, and I would like to mention here that the methods of contraception are as old as the history. And if we look back in history, we see that the mention of contraceptives has been even found in the papyruses, and there we have seen that they used to insert pessary of crocodile dung or plugs of honey gum as a contraceptive. Hippocrates, who is regarded as the father of medicine, and he's also a pioneer of Unani medicine, he also described coitus interruptus and using a finger to wipe out the semen from the vagina for contraception. He also mentioned use of wild carrot, which is a known contraceptive medicine in Unani system of medicine. The great Greek philosopher Aristotle also mentioned the use of olive oil, cedar oil, or ointments as spermicidal. Pomegranate was the first hormonal contraceptive which was used by the Greek women. Either the shell of the pomegranate was put in the vagina so that the entry of the sperms were hindered, or sometimes it was even used orally. Dioscorides, who is a very eminent Unani physician, he recommended suppositories of peppermint with honey and many other drugs for contraception in his book De Materia Medica. And it was a very standard source of contraceptive information till 16th century. Ismail Jurjani, he is also again a very famous Unani physician. He first described the method of wrapping of penis with a soft cloth before coitus to avoid conception. So why I have mentioned here is that the modern, now the barrier method, the condoms, this is how it was evolved. So basically our Unani physicians had this vision long years back. And it is also, you will be also surprised to know that Avicenna, who was a very famous Greek physician, he used intrauterine pessaries for contraception, and even long back they used to insert pebbles in the camels during journey so that they will not conceive. So somehow the concept of IUDs have also evolved from the ancient Unani medicine. And if you go look back to our Unani literature, we see that Unani literature is flooded with the description of contraceptives, be it Al-Qanun Fitib, be it Zakhira Khwarizm Shahi, be it Mufradatul Adwiya, or Aksir Azam, or Ramuz Azam. These are all Unani classical literature which has been written in 1980 or 1110 AD, long before thousands of years ago they have been written, and all of them have surprising a very comprehensive description of contraceptives. If we come to the Unani concept of contraceptives, we will come to know that Unani eminent Unani physicians, they had rules. So contraceptive should be adopted to these women. As ma'am has already told, that contraception is a very good method of improving the health of the child, maternal and child health. It's a very important component for maternal and child health. So Unani physicians had also this perception, and they also defined these are the categories of women who need contraception. And usually 3 types of contraceptives were used. Number 1 was the major which were used to prevent contraception, that is mane hamal or contraceptives. Second is if somebody conceived, and the agents which used to bring about the expulsion of the fetus, that is the abortifacients. And third was an agent which used to induce menstruation in case of missed periods. These are called as mudirehas or immunogogues. So in Unani system of medicine, the contraceptives were used in 3 categories: contraceptives, abortifacients, and immunogogues. And coming to the types of the contraceptives used in the Unani system of medicine, we have oral contraceptives. We have more of the local applications on the genitals, or putting of the vaginal pessaries or ointments, and immunogogues and abortifacients. So coming to the local contraceptives can be used as pessaries, suppositories, ointments, and pastes. These are some of the local application of sesame oil with onion extract was used on the penis as an contraceptive. Shokran was used locally on the genital, male genitals. Shahmehanzal, Kibrit, Sakmonia, these are all Unani herbs which were used as a pessary after menstruation to avoid pregnancies. And we have a long list of oral contraceptives also which were used and which are mentioned in our classical literature. I will not go into the details because these are not prevalent nowadays. And we have a long list of immunogogues. We have oral immunogogues also, pessaries also, and we have some decoction of medicines which were used for sitz bath also. So then coming to the abortifacients, you can see in these types, or in this time also in the tribal areas of India and many parts of the world, local abortifacient drugs are used. They are usually inserted locally into the vagina and they usually cause very serious complications. We all have witnessed through many of the documentaries who have put this evidence that people use in the remote tribal areas, they use these local abortifacients. But these abortifacients were described in our Unani medicine. If they are used properly, maybe they can be used, but nowadays they are only used by the tribal people. Now I have assembled a collection of drugs which were mentioned in the Unani classical literature, and we have some modern evidence studies, in vitro studies have also supported them. First, I would like to take neem oil. Basically, if you look back in the Unani medicine literature, it says that if a woman consumes 4 to 5 grams of neem oil orally, it can lead to sterility, it can lead to conception. And even the modern people, they have also done in vitro studies, and they have found that there are many chemical constituents in the neem which have anti-implantation effect. This is the study which was conducted by Asim in 2013. Likewise, pudina or peppermint, it is also mentioned in various Unani books that use of peppermint or pudina as a pessary can help as a coitus, before coitus can help act as a contraceptive. And recent in vitro study have also established the anti-implantation effect of this mentha ervensis. It was done in 2015. The third herb, which is a contraceptive, that is onion. Extract of onion is used as an ointment on the male genitals or in the form of pessary in the females. As a contraceptive, it is mentioned in the old classical literature. And the in vitro study have also proved that it is anti-implantation activity at a dose of 300 milligram per kilogram in the mice. This study was conducted in 2009. Abhal, that is juniper cuminis, it was used with combination of many medicines in the tablet form for miscarriage or for the local paste before coitus. It was inserted as a pessary also. And in vitro studies have also proven the effect of abhal as a contraceptive. White lead, it was also used locally on the male genital before it is mentioned in Al-Qanun, which is a very important book in Unani classical literature. And in vitro effect of white lead on human sperm has been established. It reduces the sperm mortality, it is spermicidal, and this has already been established. Next herb, Unani herb, which has been proven is that is halela. It has been mentioned by Hakim Muhammad Azam Khan that halela can be used in the form of pessary as a contraceptive. And now in vitro aqueous solution of Trimanella tubula has a significant anti-spermatogenic effect, and it has been proved. So this my point of showing all these Unani herbs with the modern evidences is that we have many medicines, herbs which have proven in vitro contraceptive or anti-implantation or spermicidal effect. But anar, this is also a very important medicine which is used in the Greek medicine, in Unani medicine as a contraceptive, and it has again been established by in vitro studies that it has contraceptive effect. These are the list of drugs which have been proven, on which the studies have been conducted. So what I saw is many studies have been conducted and many herbs have been established as in contraceptives. But in Unani system of medicine, I could find only one clinical trial which has been done on a polyherbal formulation of Pipertum longum, Curcuma longa, and Ferula foetida in Hyderabad, Department of Unani Gynecology in 2008. And although promising results were found, but what the problem is, it is the ethical and the legal problem we are facing while using the Unani contraceptives, which I will discuss in the coming slide. So the challenge, why are Unani contraceptives practically used, or I should say, are Ayush contraceptive practically used in spite of having so many medicines which are clinically in vitro proven? They have contraceptive effects, spermicidal effects, anti-implantation effects. Still, we don't have a area where we can say, yes, this is a contraceptive, Ayush contraceptive, which is widely used, as we can see the barriers, the Malardi, Chaya, and all the things. In fact, I would like to share that in our OPDs also, we also promote, we do a family planning, counseling to the patients. We give them barriers, we give them oral contraceptives, but we have, yes, we have supportive treatment to give them, but we cannot only rely on the Unani contraceptives. The reason is ethical and legal constraints. What maybe I see, if in my personal experience says, yes, this is a very good contraceptive, this herb, but what in case in case of contraceptive failure, who will protect me? What will be the consequences? Nothing is defined. Basically, this is the very big problem we face whenever we want to implement the vast knowledge, the immense knowledge of our system practically in a way of contraception. And second, most important problem is that we don't have a contraceptive formulation in the market. There, I don't know of any Unani formulation which is in the market, and obviously the lack of human trial, because as ma'am also said, these small clinical trials are not sufficient to initiate a patent for a contraceptive, Unani contraceptive. So we need a very good human trial so that the Unani contraceptives may be established and they can be used practically. So what is the need of the hour is, we have already in vitro studies, we have many studies, and if I combine Unani, Ayurveda and homeopathy, it may amount to a bulk of studies. So we need now human trials, more and more clinical trials. For that, our councils, they need to come forward and they need to work on this area. It is an unexplored vast area, because what we see, we all witness that modern oral contraceptives, they have many side effects, and people are not, I already, my first slide showed that we have 155 million women who are not adopting any contraceptive because of the fear of the complications of these contraceptives. So for those people, we need to work. We need to launch Unani contraceptives in the market, make patent Unani contraceptives so that people can come forward and use it. For that, also, as ma'am had also excellently deliberated, that we need a collaboration with the conventional medicine, so that maybe we can use some contraceptives as add-ons like pessaries or for the local applications, or sometimes we can initially give our medicines with their contraceptives, so that we can have more and more confidence, or we can know in which direction to go. And we need more of the microbiological and more of the biotechnological studies to establish whether our medicines are working in the contraceptive way or not. Although what my perception is that the medicines which have been used since thousands of years, they were definitely, and in vitro studies have also proven that they are effective. So definitely this is a very new and unexplored area with a lot of scope, but we all need to come forward. We need to do more of the collaborative research. We need to, the pharmaceutical companies need to come forward and work in this direction. And at the same time, council, and all the Unani and Ayush fraternity need to join their hands together to work together. And I wish maybe in the coming years, like the World Contraceptive Day, we will be celebrating Ayush Contraceptive Days also, and we will adapt and we will explore and invent the new Unani acceptable ways of contraception. With this, I would like to end. Thank you so much.
Thank you, madam. Thank you for a wonderful presentation. We are extremely glad to hear your experiences and knowledge in the field of Unani. So, thank you once again for being with us.
Thanks a lot, sir.
Now,
Sir,
yes, madam.
thanks a lot.
Yeah.
Thanks a lot.
Now, moving on to our next presentation, we'll be continuing with Dr. Madhu madam's presentation. Dr. Madhu ma'am?
Yes, sir.
Yeah. The sound is okay. And I think today being a Sunday, most of us are having some network issues. No problem. This happens at time. Yeah.
Yes.
And so Dr. Madhu ma'am is Associate Professor in SDM College of Ayurveda and Hospital Hassan. So we'll be continuing with her presentation. Yes, madam.
Yeah.
You can. The stage is yours.
Yeah. Directly we'll go on to the third slide because I have already explained first two slides. I hope you all heard it. So the growing population, right? The next slide. So today we'll just see the Ayurvedic concepts that which are explained in Ayurveda. So just to look into the definition of contraception, it is artificial or natural means to prevent the conception, right? The conception or the progeny by using the various devices or chemicals or the barriers or something. So these are called as contraception. Right, the Ayurvedic contraception, those are naturally obtained and those are used by the various people. So the history of contraception, if we see, it is mentioned in the Atharva Veda. About the history, we can get in Atharva Veda, which is available in the Vedic Research Institute. So there is a reference in Atharva Veda, Kaushika, Sutra, etc. and all. So they have told the prayers and the surgical methods like crushing the testes, vasectomy, hysterectomy, and some of the medicines or the medicaments to produce the sterility and infertility for both female and male partners are said in the Vedic period. So this reference we have in the Atharva Veda. And if you go into the historical review, the Egyptians, there is a reference of vaginal plugs of gum and honey, which is applied to have contraception. The Chinese literature says that the use of mercury or the lead to control the fertility, which is often resulted in the sterility. Not only the sterility, the mortality rate was seen. And Africans, there is a reference that to use the gunpowder and camel foam to get the contraception. The Greek reference says that the 4 plants were centrally placed for contraception. Those 4 plants were pomegranate, pennyroyal, pine, and vertex. So, like as Madam told in the previous session, the pomegranate, those are used in the Unani medicine also. What astrology says? So we know that certain planetary positions, the grahas, which are in the time of coitus, described to determine whether the conception will occur or not. Now also we can see some Chinese calendars from which we can tell that whether she will conceive or whether she will conceive, if she is conceiving, whether she can conceive male or female. Such a calendar is available now, right? So the explanation what we can see in the Ayurvedic classics, we can indirectly say that there are few references for spacing the children, like that is a difference before one first birth and second birth, the difference between the ages of 2 children, and the social law of life, and some practice of the yoga and pranayama that causes contraceptive effects, and explanation of some oral and local medicaments are told in our classics. So okay, it is not seen. This shloka is already explained. Yeah, fine. But this shloka is already explained by Madhura ma'am. She said that one best progeny is enough than having hundreds of progenies. So that is the shloka here. It is explained. And if we classify, there is no direct classification we get in our classics, but we can classify by looking into the different contraceptives which are available. So swabhavik or practice of yoga and mantra, application of bahya avarodhas or bahya prayukta aushadhis or sthanika prayukta aushadhis, all these are the classification what we can do according to the the available classics. There is no classification told in the Ayurveda directly, but we have some references by which we can tell that there is a we can classify so like this. So the last one what we can see in the slide is abhyantara prayukta, that is whatever these are last three are directly it is explained in Ayurveda. So what may be the swabhavika contraceptives to consider? It is just the observation of the yes, next slide only. Observation of abstinence, that is brahmacharya, right? If we follow the brahmacharya, of course, it acts as a contraception. That is what the meaning of swabhavika here. Then the stages of human life was explained, like balyavastha, vanaprastha, ashrama, like that. In that, grahastha period was limited for some years, so that the active reproductive period can be reduced and the chances of pregnancy will be reduced. Now we can see, no, we have seen in the previous in the newspapers and all, the 70 years, 80 years people are conceived, right? Of course, the reason of conception is something else, but when we are not using the contraception, the the following the brahmacharya or abstinence may be the very good contraception what we can have. The stages of human life we were talking about, the grahastha-ashrama, right? Then delay the marriage. So the marriage, it is explained in Ayurveda that the girl attaining the age of 18 and the male attaining the age of 21 can get married and have progeny. To have progeny, the girl should be 21 years and the male should be 25 years. So, and there are different opinions also, of course. So, if we delay the marriage, the active reproductive time will be lost. So, this is one of the other reference what we can have. And sexual abstinence, of course. Then incomplete coitus, which is explained in our classics, I mean modern sense also, the coitus withdrawal, right? Before the ejaculation in the upper vagina, high in the vagina, the penis should be withdrawn out. So that is the incomplete coitus, we have the reference. And the lactation period. If the lady is lactating for longer time, that reduces the chances of conception. We get many patients telling that baby is just 6 months or 7 months, she has conceived once again. Ask for the history. I just had 2-3 days back, not 2-3 days back, yesterday on my OPD, there was one patient, she approached us telling that she was pregnant of 8 months. I just asked her, is it first pregnancy or second pregnancy? She says second pregnancy, and her previous baby was just 11 months. And I asked her lactational history. She said she did not, she stopped feeding at second month itself, and she's pregnant once again. All right. So these are the things. And these things we have already seen. We can skip 2-3 slides, Dr. Jayesh. Yeah, next slide. Yeah, next slide. This we have already seen. Then the yoga and pranayama. So though it is not practiced, there is a reference of yoga and pranayama which can cause act as contraception. First one we can consider is manonigraha over maithuna karma, the control over the intercourse, that can have the contraception, and virtue of psychological demand what we have and avoiding the conjugal relation. Conjugal relation means the intercourse, the reproductive relation only. So to avoid that, and there are certain pranayamas told in yoga and contraception book by Dr. Ramaswamy, and it is also explained in some of the Upanishads. Some yogas are explained for the contraception. The next slide. Some of the yogas which are explained are the first one, nose pose. Like this is the posture what we can have for the contraception, that is nose pose. And the next like yoga which what we can have for the contraception is Garbha Pindasana. So how the baby is present in the maternal body, like before the delivery, that such a asana can be followed to have the contraception. The next one is Bhadrasana, that is the gracious pose which is called as the third asana. So that third asana also we can follow for having the contraception, that is Bhadrasana. The next one is Matsyendasrana, so which resembles the Matsya. And the last one, Bahya Kumbhaka. These are the 5 asanas explained in that yoga and pranayama book for having the contraception. But how this yoga and pranayama will act, or how these will be helpful? Again, the reason is given in that same book, that of yoga and contraception by Ramaswamy. He says that these asanas and pranayamas will work on the pelvic organs. Those will compress the pelvic organs. Those will give pressure over the pelvic organs, and they will twist and squeeze the uterus, so that when they twist and squeeze the uterus, the implantation will be prohibited. Or if the implantation just occurred, that will be flown away. So this is the reason what is told in the contraception, in that book, Yoga and Contraception by Ramaswamy. And the mantra therapy, the Garbhasthapana, like mantra, Om Sambhaya, that is for Stambhana, the Omkara is formed. Om Garbhasthambanaya Swaha. Om Garbhasthambanaya Swaha. Like this, the chanting is told. This is explained in the Megha Vinoda, the reference we get in the Megha Vinoda. And the other method for the contraception, what I have listed out is Bahya Avarodhas, which can be formed. So the explanation what we get in the Rati Rahasya, as the individual should press the pore, or press the testicles, and like forepart of the testicles during the sexual enjoyment, and they should divert the mind to other things. This is what is told in the Rati Rahasya, which can be considered for the Bahya Avarodha. Next is Brahya Prayukta Aushadhis. Some of the medicines explained for the external application, that is Datura Mula, the drug Datura is taken, and that Datura is tied tied over the waist of the lady on 14th day, right? This is explained by Yoga Ratnakara. So again, the Rati Rahasya, he explains that the right side bone of black cat, right? The black cat's right side bone is to be collected and is to be tied in the waist of the person. And the root of Shweta Shashapa, it is put in the hair, on the hair before the coitus. This is a reference what we get. But of course, it is not followed nowadays. Few of the things which I followed, I'll be dealing next. The Sthanika Prayogas or the Sthanika local treatment, what we get the reference in our Ayurvedic classics is, first one is Yoni Purana, right? The Yoni Purana, the filling of the things. So Saindhava Khanda, that is the piece of Saindhava, which is dipped in the Tila Taila or the Taila, is to be kept in the vagina before the coitala, tells the Bhava Prakasha, right? And the other references in the Bhava Prakasha says, Palasha Beja Churna with Grita and the Madhu is to be taken or applied during the Rutukala, right? This is one more reference what we have in the Bhava Prakasha. And Yoga Ratnakara also says that the Tura Mula Churna Purana, right? Next, Yoni Dharana. Yoni Dharana is the, again, the like what, whatever the filling of the Yoni, only we can consider. Same thing, what we have explained, the Patra, sorry, the Tura Mula and the root of Indrayava and Parpati, which is prepared of honey and is to be kept for 4 days after the 4 days of menstruation, so that the follicular phase will be hampered. Next, we have reference of Yoni Pichu, where Yoni Purana with the Nimba or Nimba Taila Pichu is used. As Madhura ma'am was explaining, they are practicing the Yoni Nimba Taila for the contraception. Next, Yoni Dhupana we have of Dhupana of Nimba Castor at the end of Rutusrava, that is the end of the menstrual phase, what we can have. But how these are helpful? We don't have like proper reason to tell. But if we consider all these may be acting as mechanical barriers or spermicidal action. Whatever the drugs what we are using or mentioned above are spermicidal, right? So those, and whatever Purana done and Dharana done, those will act as mechanical barriers for this. Next, there are few drugs which are explained for internal medications. So we'll just go through the name of the drugs which are used. So the first one is Haritaki. It is told as Shukra Shoshini. It is considered as, we can consider it as for male contraception. So in the classics, the Haritaki is named as Shukra Shoshini. So it acts as spermicidal or it reduces the sperm count. Next, the Atasi in the Bhava Prakasha, it is told as Shukragni. So it reduces the Shukra. Next one is Avrashyam. So the Maricha, Trinadhanya and Dhanyaka, these are considered as Avrashya, right? Which is, Vrashya is of course which is useful for the conception. Avrashya, it is contraceptive. Then Pumsatva Nashanam, the what Khaskasa and Chanaka are considered as Pumsatva Nashaka. How these will be helpful? Maybe they act as spermistatic or spermicidal, or those inhibits the spermatogenesis, or maybe even those acts on the male hormones if they are used orally. So these are the male contraceptives, right? So the actions may be on the spermatogenesis, or it reduces the movement of the sperm, or it kills the sperm, right? So the female, few of the experimental studies done on the female contraception, that is male contraception, that is Amalakyadi Churna, right? The ingredients taken was Amalaki, Vibhitaki, Pipali and Chitraka. So the animal studies shows it has anti-spermatogenic effect or anti-androgenic effect. Next is Shirisha. So the Shirisha, its extract, that is methanolic pod extract, has activity, or it has the quality of decreasing the sperm density, right? And the Lashuna, which has an active ingredient, that is elytridium, which is a spermicidal effect. It is examined on the rat, and it is proved to have spermicidal effect and it hampers the spermatozoa. Next, papaya seeds, right? The chloroform extract of papaya shows azoospermic effect. The person becomes azoospermic after 90 days of treatment. Next, cotton seeds, right? Flamanols extracts of the cotton seeds are arresting the spermatogenesis. So these are the male contraceptives what we have in reference in Ayurveda. Next, there are few female contraceptions. The reference we have in Ayurveda is Japa Kusuma, right? So the Japa Kusuma, which is given in the Rutumati 3 days with the Shita Jala. The animal study shows that the ethanol extract of this Japa Kusuma has anti-inflammatory or estrogenic activity. That is published by some article also, which is the reference given below. And the Pipalyadi Churna, the next one. We have reference in Yoga Ratnakara and Bhava Prakasha. The ingredients used are Pippali, Vidanga, Tankana, right? The dose is equal in these 3 ingredients are taken in the equal quantity and taken as or made as capsules, and the extract from it or the contents of those will be helping in increasing the estrogen. If estrogen level is increased, the pregnancy will not be maintained, right? And it inhibited the fertility in 62% of the rats. The study is taken on the albino rats. The next one is the Dhatri Abhay Rasanjana, reference of Yoga Ratnakara. It is to be taken throughout Rutukala with the Shita Jala, right? It is having anti-implantation activity. Next one is Thali Sapatra with the Swarna Gairika. The quantity will be like it should be taken equal quantity, that is Thali Sapatra and Swarna Gairika should be taken in the equal quantity with Shita Jala for 4 days. It should be taken from the 4th day of menstruation, that may be in the follicular phase. Next, Pipalyadi Churna, where we have Pippali Naga Kesara Haridra as ingredients taken for 3 to 5 days in the Rutukala with Shita Jala. Next, the single drug Maricha, which is taken as with the Sharkara Udaka, and it should be taken for 3 days during the Rutukala. Next drug is Lavanga. It is to be taken, single Lavanga is to be taken for whole month. Next is Haridra. Again, it is to be taken 3 days in the Rutukala. Next, Vidanga Churna. It is to be taken from the 5th day to 15th day. And seeds of Palasha is to be taken 2 Karsha Pramana for 7 days with the Tandulodaka. And the last 2 what we have is the Purana Buddha, right? We know that Purana Buddha is Artavajanaka, and it is to be taken 1 pala thrice a day, thrice daily, for that is in the TID dose for 15 days after the period of menstruation. Next, the last drug, the reference what we have is Chitrakamula. It is to be taken 3 days after the menstruation with the Kanji, right? The study which was done on female rats, they showed 100% prevention in the ovulation. The rats which took those medicines had 100% an ovulation. How it acts? How these drugs acts? So those acts by altering the vaginal pH, or it brings change in the cervical mucosa, because cervical mucosa is changing to have the easy facilitation of the moving sperms in the vagina, right? Then the decidual, altering the decidual bedding, so that it acts as anti-implantation. So it inhibits the implantation. Next is ovulation inhibition, that is causes anovulation, and it may also cause the tubal block. Thus acts as a contraception. Next, the Swarasa of Palasha Pushpa can be taken, or Yavakamula Kwata. These are all the oral medications what we have. Next, we have unique therapy for the spermatogenesis. I mean, sorry for contraception, that is Nasya Karma. We have the reference in the Rasarasa Samuchaya as Apamorga Churna Nasya is to be taken before the is to be done before the coital act, or Langali Mula Churna Nasya before the coital act, or Maricha Churna Nasya before the coital act. Right? So these are the references. But there are a few researches took place among in these drugs which are explained in our classics. Few of the research articles, let us see. The anti-fertility effect of the Nimbathaila, which is prior to the coitus, prevents the pregnancy, which is published in the PubMed in 2014, which has spermicidal activity. The other article, which is again the neem is used in the monkeys. That is it is an insertion, right? IUCD, whatever the property what we have, and that such like that only the neem was inserted in the monkeys, and they had what it blocked the fertility for 7 to 12 months. The next one is about the some of the medicinal plants which are used for the what non-contraceptive methods. So they had done in it was done in around 2001 for 355 patients, and there was those drugs were taken for the TLC and HPTLC studies and showed the contraceptive results. Then one more thing on the some of the drugs used as female contraception. This article is published in 2009, and those also had very good effect. But only thing is we cannot give 100% surety to prevent the conception. That was a drawback with the study. The drug used were Japa Kusma, Tali Sapatra Arjuna, Nagakeshara Sharshapa Haridra, etc. These drugs were used in that study. The next what we had was coitus interruption, and that coitus interruption was what the research was done on it, and they published the articles. Again, it had encouraging results, but again there was no expected result to have the contraception. The sixth article, next 2 slides you can see, Jayesh. The next sixth article I have collected here is Pipali, use of Pipali. Pipali, Vidang and Tankana was used, and again it gave good, the study was taken in the IRES institution in the Ahmedabad, right? They had a criteria, that is 26 to 34 year the ladies were taken, and the pregnancy was spacing question for 13 to 24 years. Next is there is one a capsule which was prepared by Rajasthan Herbals International. That is Contra 30 tablets. The name of the tablet is Contra 30 tablets. So it had Vidang extract, Shuddha Tankana and Pipali. One capsule is to be given with milk, right? There is no side effects recorded, but even there was no 100% contraception observed also. So bottle had 60 capsules. One more preparation what we have is B-gap contraceptive pill, where the Tinospora cordifolia, chloride of sodium, Berberis aristata, Resimus communis. So these were the ingredients, and it is to be taken 1 tablet or from the end of the menstrual cycle. Next, how these are acting. So what they claimed is about the B-cap capsules, that is it makes a salty layer on the ovum and prevents the fertilization. So these are all the Ayurvedic concepts what we have in our class, and the few research which are taken place. And of course, I'm not going into the detail of the contraceptions in the modern science. The same thing I explained, that is the temporary and permanent methods. So to conclude the session, I want to tell that the modern contraception have their own side effects, right? The oral and hormonal pills which used are having, they alter the physiology, and there are many things which are occurring. So our literature, whatever the contraception explained in our Ayurvedic classics, that can be tried, but it should be tried in the large basis quantity. So few of the contraception which are explained in articles, which are published in articles also, they are giving the promising results. So these can be considered for the contraception method for the family planning. So we can conclude like telling, for an adult, the choice should be their own right. The choice of contraception is human right. We cannot compel the lady
Excellent.
to have our choice. So this is what I want to convey. Thank you.
Excellent, Dr. Madhu. Excellent. Great. Very nice topic and very nice opinion. Right. Scientific lecture. Thank you to you, and thank you to Dr. Swaz Sethi ji. Thank you very much. Thank you very much. Thank you very much.
Thank you,
Dr.
the organizers,
Jayesh.
Pavan sir, sir, everybody for the opportunity.
Jayesh ji.
Yes. Thank you, Dr. Madhu ma'am, for a wonderful presentation. All the three presentations of the day were insightful, and I'm sure that all of us have learned lots of new things. Now, the session is open for question, answer, and discussion. So, any of our delegates have anything to ask or discuss are welcome. I'm sure the presentations were complete, and most of us would be having the idea that we should need more of research and more of studies for the application part. Yes, Dr. Madhura ma'am.
Yes.
Yes, ma'am.
This is really a nice, there was a nice effort by Zandu Pharmaceuticals, Dr. Pavan Kumar ji, really thoughtful session, and we can present our own Ayurveda science globally, that yes, we have options not for contraception but for better progeny, so we can support the world with our concept of better progeny, and definitely in the world of contraception, our better progeny concept should taken up, and more research we can do it together. Thank you for the
Very right, you are very right.
Thank you for the wonderful interaction.
Yeah, thank you, madam. Thanks a lot. Thanks to all the speakers. I think Dr. Jagdishwar ji, would you like to add in something? Okay. So the presentation of the day were really excellent, and we are grateful to all our speakers. So for the concluding remarks, now I would like to welcome Dr. Suhas Sethi sir for the concluding remarks.
Hello. Hello.
Yes, sir. Yes, Jagdishwar ji. Yes, sir.
यहाँ पर एक रेफरेंस में ब्रह्मचर्य करके प्रस्ताव किए। ब्रह्मचर्य का असल मतलब होता है ब्रह्मे विचरणम इति ब्रह्मचर्य। Brahmacharya does not mean abstinence or celibacy, because these two are different from brahmacharya. And simultaneously, about the progeny, what we have discussed, actually before conjugation, the couple should have good thought and good opinion, and at the same time higher thinking. It's not that human beings have the conjugation like animals. Though it is instinctual, Ahara nidra bhayamaitunancha samanyamaitad pashve narana. They are instinctual and common with the animal being and human being. But here, with the human being lies ideation. That's why Anandamurti ji termed it, human beings are not developed animals. Human mind is the flow of ideology. None others animal being is subjected to ideological flow. That's why whenever, whatever happen, whatever stage it may be, but one should have a kind of high ideals before conjugation. And if it is so that it is also an act that the progeny will be the incarnation of God. I don't say incarnation, that the जातस्य जो होता है वो ब्रह्म का स्वरूप है मानना करके आनंद मूर्ति बताया। जो शिशु होता है वो ब्रह्म स्वरूप है माना। तो अपन जब अपना थिंकिंग जब उस तरह का दे देते हैं तो वास्तव में we will get good population, not evil population or criminal population. Now whatever in the modern society is going on, in modern society it is going on like animal conjugation. What I feel because
Yes, sir.
I don't influence all.
Agree, sir. In modern time,
but
we do need a family planning and all the concepts. Right, sir. Absolutely right.
One more thing. Spiritual personalities, actually what I observe and you may be observing, will get less progeny comparatively non-spiritual beings. They have only mechanical action, but they don't have ideal thinking, ideal way of life. That's why what we have to project, even in course of our life of the modern society, we should have a little bit more attention towards spirituality. Then only a good society will be launched. What we can say that Sangachadvam Samvadadvam Samo Manam Sijanatam Deva Bhagam Yatha Purve Sanjanana Yupasate Samaneva Akuti Samana Hrudayaniva Samanamastu O Mano Yathava Susati. ये ऋग्वेद का है। तो ऐसा जो अपन सोसाइटी संघ बनेंगे, कंपनी बनाएंगे, वो कंपनी क्वालिटेटिव कंपनी होना चाहिए, क्वांटिटेटिव कंपनी चाहिए। क्वालिटेटिव कंपनी
आत्मादि विज्ञान धी धैर्य आत्मादि विज्ञान or the concept of Sarir Man Atma have been the basis of Ayurveda. So, and we are really grateful to have your opinion. And no doubt, we had an excellent presentation from Dr. Madhura ma'am, Dr. Madhu ma'am, and Dr. Paraswani madam. So, we'll be concluding today's session. Our host, Dr. Pawan Sharma sir, have been joining with us from New Delhi from the Ayur Yoga Expo. Despite being busy to continue our mission to celebrate every day with Ayurveda, we have been successful today even. Tomorrow again we'll be meeting on the topic of ENT and we'll be having a wonderful session, and we'll request everyone to join with us. The live streaming of this program have been in the Independent Research Ethics Society channel. We are thankful to all the organizing team. Thank you once again to all the speakers and the delegates who have joined with us. Thank you. So we hereby declare the meeting as the end. Thank you.